Okay, so you've just had cataract surgery. You're in recovery, and let's be honest, even the simple stuff can suddenly feel, well, a little overwhelming, right? Today, we're going to cut through some of that confusion. We're going to make one really important decision super simple, picking the right preservative-free artificial tears.
And really, it all boils down to this one question. Should you go for the little single-use vials or the multi-dose bottles? That's what we're tackling. And I promise, by the end of this quick explainer, you'll have a crystal clear idea of which one is the right fit for you, for your hands, and most importantly, for your healing eye.
You know, this quote just nails it. Your eye is healing. And that's the whole reason your normal routine can suddenly feel like total chaos. I mean, a drop that felt totally fine before your surgery might suddenly sting a little, or just feel off. And listen, that's not you being dramatic or overly sensitive. It is literally just part of the healing process.
So let's start with the big why. Why does preservative-free even matter so much right now? It's not just some fancy label on the box. No, it's actually a key strategy for handling that extra sensitivity while your eye is healing.
Yeah, your eyes after surgery are they're more reactive. Think about it like this. The surface of your eye is basically a construction zone right now. It's recovering. And with all that's going on, the healing, the inflammation, maybe some medicated drops, it can get a little touchy. It might overreact to things it would normally just shrug off. So starting with the gentlest possible option, it just makes a ton of sense.
So what does preservative-free actually mean? Well, it's pretty simple. It just means the drops don't have certain chemicals that are usually added to prevent bacteria from growing in the bottle. The thing is, those same chemicals can sometimes be irritating, especially for a sensitive eye. And when you're putting drops in multiple times a day after surgery, yeah, avoiding anything that could cause extra irritation is a really smart move.
All right, on to the main event, vials versus bottles. So you're on board with preservative-free. Great, but now you're standing in the pharmacy aisle staring at the shelf and you see these two completely different options. Let's break down what this choice is really all about.
And here's the real trade-off boiled down. With the single-use vials, you get the lowest possible risk of contamination. But it's a bit more of a hassle every time you need a drop. That's the higher daily friction. With the preservative-free bottles, it's way easier day to day, but it demands more from you. You have to be super disciplined about how you handle it. So are you optimizing for rock-solid safety or for daily convenience? There's no wrong answer here, just what's right for you.
Let's really dig into this. Look at the single-use vials. Contamination risk? Basically zero. It's a one-and-done deal. You open it, use it, toss it. That makes them a fantastic choice if a caregiver is helping you or if your hands are a little shaky. The downside? They often cost more per day, and yeah, there's more packaging waste. Now the multi-dose bottles. They're usually cheaper, less waste for sure. But look at that contamination risk. It's low if handled perfectly. Their safety is 100% on you and your technique every single time.
Okay, let's talk about what that risk actually looks like. Because contamination sounds so dramatic, right? But it's not. It's usually just a tiny slip-up in your routine that happens over and over. And honestly, understanding this is probably the most important part of making your choice.
And here they are, the usual suspects. We're talking about the dropper tip accidentally brushing against your eyelash or your eyelid. Or maybe you set the cap down on the countertop for just a second. Or you grab the bottle without washing your hands first. It's these tiny, seemingly innocent moments that can introduce germs into the bottle.
I absolutely love this way of thinking about it. Imagine that tip is a tiny microphone. Whatever it touches, it records. You definitely don't want your eyelashes or your fingers or the bathroom counter on that recording, right? The whole point of a clean routine is to keep that recording totally blank. So no matter which one you choose, this is your best defense. This is the routine. It's a simple little four-step dance. Step 1, wash your hands and wash them well. 2, open the vial or bottle, being super careful not to touch the tip. 3, put the drop in your eye without the tip touching anything. Not your eye, not your lashes, nothing. And 4, either toss that vial immediately or screw that cap back on the bottle nice and tight. That's it. That's what protects your eye.
Okay, you have all the background now. You know the why and the how. So let's put it all together. We're going to walk through a super quick decision guide to help you find the perfect choice for your situation right now.
Now let's be real for a second. Read through this list. Do you have shaky hands? Maybe a little arthritis? Does someone else, a caregiver, help you with your drops? Are you just kind of anxious about the whole contamination thing? Or do you travel a lot?
If you're nodding along to any of these, especially if you know you sometimes accidentally touch the tip to your eye, then the single-use vials are your friend. They are, hands down, the simplest, safest bet because they take all that guesswork out of the equation. But what about the bottles? Okay, you should go for the preservative-free multi-dose bottle if you have really steady hands and you're confident you can nail that no-touch technique every time. Or maybe you're putting drops in constantly all day, and the cost and waste from the vials is a real concern for you. And, this is a big one, you have a clean, consistent spot to keep the bottle. If that sounds like you, then a multi-dose bottle is an absolutely great, very smart choice.
Okay, I need you to really lean in for this next part, because it might be the most important thing we talk about today. It's your safety net. Look, a little dryness, a little irritation, that can be normal. But some symptoms are absolutely not normal, and it is so critical that you know the difference and you know when to act.
Take a good look at this list. These are the red flags. We're talking about pain that's getting worse, not better. A sudden change or drop in your vision. Redness or any kind of discharge that's increasing. Or light sensitivity that's getting more intense. These are the signs that say, do not wait. If you experience any of these, you call your surgeon's office. Urgently.
And I really want this to sink in. If you have any of those symptoms, you are not being dramatic by picking up the phone. You're not overreacting. You are being a smart, responsible partner in your own recovery. You are doing exactly what you need to do to protect your eye and your vision.
So after all of this, if you only remember one single thing, please let it be this. A clean routine will always beat a perfect product. You could spend a week researching the absolute best, most expensive eye drop on the market, but if your technique for putting it in is sloppy, it just doesn't matter. A simple, basic product used with a clean, careful routine wins every single time.
And that really brings us to the final question I want to leave you with. Take an honest look at your own routine. Is it truly built for safety? Or is it maybe just built for convenience, for the path of least resistance? Remember, the best choice you can make for your healing eye is always the one that makes being safe easy. Thanks so much for joining me.